This is a review of VeganSafe B12 from Global Healing Center. First off, I want to give some background on vitamin B12 and why you should supplement with it. I will share some articles that I found just by doing some quick searching in my university library database. One article I found that was published in June of 2015 is titled Vitamin B12 and Folic Acid Improve Gross Motor and Problem-Solving Skills in Young North Indian Children, a randomized placebo-controlled trial. One interesting thing to note from the article title is that it mentions folic acid, and in just looking through articles in my university database, I noticed that folic acid was mentioned pretty frequently along with vitamin B12. And if you look at the results from this study, it says that, and I'll quote here, with the exception of a significant improvement on gross motor scores by vitamin B12 alone, supplementation of either vitamin alone had no effect on any of the outcomes. And in case you don't know, folic acid is one of the B vitamins. It's sometimes known as vitamin M or vitamin B9. So, if Global Healing Center is watching this, maybe it might be good to combine some folic acid with your B12. I don't know. I'm no expert on this stuff. But just in my brief browsing through these articles, it looks like there is some connection. So here's another article. Lower circulating B12 is associated with higher obesity and insulin resistance during pregnancy in a non-diabetic white British population. So the conclusion of the article states, our study has replicated the previous Indian findings of associations between lower serum B12 and higher obesity and insulin resistance during pregnancy in a non-diabetic white British population. These findings may have important implications for fetal and maternal health in obese pregnancies. Here's another interesting article. It's titled Vitamin Supplementation in the Treatment of Schizophrenia. And I'll just read you part of the conclusion. It says vitamin supplementation, particularly with folic acid, vitamin B12, and vitamin D, may play an important role in the treatment of schizophrenia within certain subgroups. And it goes on to say, among those patients with specific genetic variants in the folate metabolic pathway, supplementation with both folate and vitamin B12 can be beneficial, especially in improving negative symptoms. And this also reminds me of something else I've seen, and you can just do a quick Google or whatever search engine search for B12 psychosis, and there have been some cases where someone is going through a psychotic episode and they're given B12 and their symptoms will rapidly diminish. Another article I have here, and this one may be of more interest to some older folks. It is titled B vitamins may be quote unquote silver bullet for age-related macular degeneration. And it says daily supplementation with folic acid plus vitamins B6 and B12 may reduce risk of AMD by 35 to 40%. And this just goes to show how oftentimes these vitamins need to be combined together. There is no one single thing that can do what the other vitamins do. You have to get them together so that they can work together. So what are the symptoms of vitamin B12 deficiency? Well, I found one article in the British Medical Journal. It mentions a whole lot of things. There's infertility, impaired cognition, depression, psychosis, delusions, irritability, cardiac problems such as cardiomyopathy. It can even affect your tongue. It can impair your sense of taste. There are also neurological issues, some of which I won't even try to pronounce. It can also cause issues in the bone marrow. And here's a pretty horrifying article. It's titled Cerebral Atrophy in a Vitamin B12 Deficient Infant of a Vegetarian Mother. And This is something you have to watch out for if you are vegetarian or especially vegan, is that you are likely not getting enough vitamin B12. The end of this article states efforts should be directed to prevent its deficiency in pregnant and breastfeeding women on vegan diets and their infants. It is also important to take the nutritional history of both infants and their mothers to the early prevention and treatment. To increase the dietary intake of vitamin B12, the diet should be rich in foods of animal origin, such as dairy products, red meat, egg, and fish. Now, one thing that concerned me about this particular kind of B12 is that their recommended serving has 41,666% of the recommended daily value of vitamin B12. That's 2,500 micrograms. That seems like a whole lot, but if you know anything about RDAs, they are often set really, really low. I doubt the average person's body is going to be able to absorb all of that B12. You probably know that some people have to get B12 injections, and the reason they have to do that is because their gastrointestinal system can't absorb the B12. And I think you also get this problem with D3 too, and probably other vitamins. But some of our bodies are just so out of whack that maybe we need a huge dose of something just to get a little bit of it. I don't know. The main thing you have to do, I think, is listen to your body and sort of semi-scientifically observe yourself on each day that you take it. What I have noticed, and I can't specifically pinpoint this down to the B12 because I've also been supplementing the X2 iodine, which Dr. Group makes as well. I've noticed that I feel more intelligent in the past few months since I've been taking this B12. I originally took the B12 that Alex Jones sells on his website, but it's the exact same thing as this. So either one will do. But I've noticed in the past few months that I felt more sort of alive and energetic and alert. Can I specifically pinpoint that down to the B12? I don't know, but I think it's the B12 in concert with a lot of other stuff that I'm doing. Now, one of the selling points of GHC's brand of B12 is that it doesn't have cyanide, which a lot of the B12 supplements out there do have it. I think it's a cheaper form of B12. However, this cheaper form of B12, the amounts of cyanide are quite low. But I guess any little advantage you can give your body is a good thing. So this is one more thing that your body doesn't have to filter out if you're taking the B12 that doesn't have cyanide. I would think that taking this B12 that has cyanide in it is certainly better than not taking it. You're already probably getting some cyanide in your diet. Foods like almonds and soy, lima beans have it. So it shouldn't be a big deal as long as you're not ingesting just enormous amounts of this stuff. So thank you for listening to this review of Global Healing Center VeganSafe B12. If you take anything away from this mishmash of information, let that be to listen to your body and give it what it needs.